Now to those of you with students on college campuses. The University of Minnesota is giving an update on how it will adapt to the new COVID-19 restrictions put in place by Governor Walz. President Joan Gable sent a notice to students saying learning will go on as planned with distance learning following Thanksgiving break. Dining system-wide will go to a grab-and-go system starting next week. Gyms will be closed except for students on college athletic teams or if it is part of a class. All museums and indoor entertainment will be closed down. Outdoor activities can continue. As all of us continue to adjust to the changes created by this pandemic, when it comes to holiday gatherings, we are being advised to do so with fewer guests around the table. But in a year dominated by COVID-19 and social distancing, as well as college students planning to return home for the holidays, what exactly is that going to look like? Health experts warning of added risks. Dr. Gigi Chella is the chief of general pediatrics at Children's Minnesota in the Twin Cities. The greatest threat, Dr. Chella, and would you agree, has to do with the 20-somethings being asymptomatic and then bringing their virus home?
I definitely think that is a threat and a concern for families, yes.
Mental health, though, is a growing concern as well. If you have a college-age student, I have to imagine as a mother, they may be a freshman, they've been on campus for a couple of months, and telling them that they can't come home, I don't know if I could do it.
Well, I can tell you that is my exact situation. I have a freshman at UCLA, and you know, I think families have to make choices, right? And you really have to weigh the risks to your immediate family and the risks of bringing that child home. For my immediate family, I don't have anyone living in my household who potentially is at an immediate health risk, you know, someone, for example, a grandparent or someone who lives in the home. And so I think there are some pathways where with your immediate family, you could bring your college-age child home. Some of those ways to do that might be having your college-age child get a COVID test and get the results before coming home, and really do a great and diligent job of self-isolating and making sure that in the time frame between getting their test results and coming home, that they're not having any exposures. It really is important that in that 18 to 35-year-old age group, that even if you're asymptomatic, you are getting tested.
That's a good point, because I think people, even though we have been told, get tested, the testing is free, and even if you're asymptomatic to do this, but people still are thinking, I don't feel sick, so they're not getting tested. The at-home tests, though, making it a little bit easier to do that. Do you see the benefit there? I am afraid that the at-home test kits, though, are going to give me a false negative.
Well, I think that there's many options now for families to choose from in order to get themselves tested. You know, the Department of Health has done a wonderful job at setting up saliva testing centers. There's certainly also nasal swabs that you can get as tests, and then any health or clinic facility is also doing testing, and all of those are really PCR tests. And so while there may be, some challenges with not having the very highest rates of giving you the most accurate test on saliva, they are almost equally as good, if not better in some situations. So I think if you get a positive test by any type of test that you are receiving, you should trust that test as positive.
That is good to hear, and that is reassuring as well. I know that when we hear from viewers, a lot of times they're like, you know, how reliable are these? So that's good to hear. How are things at Children's? All of our hospitals are reaching capacity or are at capacity. Things at Children's, though, is it different?
Well, we are definitely seeing more COVID positive patients as well. And so I think while we are not seeing as many of our ICU beds or our inpatient medical surgical beds being filled to the degree that adult facilities are experiencing it all around the state. Children do get COVID as well and need to be very just as diligent about social distancing and mask wearing and hand washing, because yes, we are seeing kids who are also hospitalized.
In the media, we have not talked a lot about children and COVID because it hasn't harmed them as greatly as it has our elderly and our senior population. But with these increased cases, are things changing on that front? The good news up to this point has been that we haven't had to worry about our children as much.
I think it's still good news. The rates of children as compared to adult populations that need to be hospitalized or have severe outcome is still much less, but it's not zero. So really doing a good job of taking all the preventative care measures that you can, not just for yourself, but for your children too. Really focusing on that is important.
Dr. Gigi Challa, I really appreciate you coming on and talking to me about this. There's just so many aspects to this. This was a good topic. Thank you.
Thank you for having me.